Go to the International Association for Hospice and Palliative Care.
Thank you, Chair. I'm reading this statement on behalf of IAHPC, but the statement is also supported by HelpAge International, the International Federation of Surgical Colleges, the Union of International Cancer Control, the World Federation of Societies of Anesthesiologists, and the Worldwide Hospice and Palliative Care Alliance. People affected by health emergencies frequently experience severe, untreated physical pain, often exacerbated by trauma and psychological, social, and spiritual suffering. Those affected include vulnerable groups such as pregnant and nursing women, infants, older adults, persons with disabilities, and individuals of all ages with serious injuries and chronic illness. Most of the 4% of the world population currently in need of humanitarian assistance live in 85% of the world where essential palliative care medicines are routinely unavailable even before emergencies occur. Secure supply chains and national stockpiles of essential medicines are a prerequisite for health emergency preparedness, response, and resilience. Emergency response teams should be trained in the safe use of these essential medicines, which all health systems must have available before they are needed in an emergency. Tragically, because health systems fail to ensure their availability, people of all ages affected by health emergencies are living and dying with entirely preventable health-related suffering. Member states can take steps to prevent this acute suffering by preemptively investing in basic surgical, anesthesia, and intensive care services with effective access to medical oxygen, basic pain and palliative care services staffed by primary care practitioners and humanitarian health workers trained to treat severe pain from traumatic injuries, wounds, burns, and acute and chronic illnesses, essential medications for acute health emergencies, community-based mental health services, sustainable cancer care, integrated health and long-term care and support for older people, maternal child health, and essential medicines for pregnant women, mothers, and newborns. We call the board's attention to the 2021 INCB UNODC WHO Joint Statement on Access to Controlled Medicines in Emergencies, the International Pharmaceutical Federation Statement of Policy on the Role of Pharmacists in Disaster and Emergency Medicine Management, and the International Narcotics Control Board's timely supply of controlled substances during emergency situations. We recommend that member states and WHO emergency response teams include adequate supplies of oral and injectable essential medicines and formulations appropriate for people of all ages in their essential medicine stock and in humanitarian and NCD response packages. Prepare healthcare workers and emergency response teams to prescribe and administer essential medicines, including opioids, in a safe working environment, and conduct public health information campaigns to provide evidence-based information about essential medicines, including those under international control. Thank you.
Thank you. And I'll give the floor to the Global Health